our Vice President has accepted promise to donate 2 lakhs rupees towards his parents' memorial lecture and 5 lakhs rupees for the corpus fund of our organization. Thank you, Dr. Srinivas. And Dr. Madhu Varanasi Garu for 1 lakh rupees, donating for 1 lakh rupees towards the corpus fund of the HMAT. And in the previous years, Dr. I.S.Murthy gold medal prize was also we have given for some period. Due to some reasons, it was not running. And so from year afterwards, I request Dr. Hemaprabha Garu also to just to give the same prize for the outstanding person from the topper of the final year of the BHMS from the college, SPS college. So thank you. Thank you.
Thank you, sir. Now I request Dr. Harshitha to introduce the speaker of today's evening, Dr. Satish Krishna.
Good evening all. Dr. N. Satish Krishna, a practitioner from Kukatpalli, Hyderabad, has completed his graduation from JSPS Government Homeopathic Medical College, Hyderabad. He pursued post-graduation in repertory and presently pursuing PhD in repertory from Homeopathic University, Jaipur. He has an established clinic at Kukatpalli since 2001 and another clinic in Gajula Ramaram. He served and treated more than 2,000 COVID patients successfully. Dr. Satish Krishna Concept Repertory started in the year 2004. This repertory includes 2,20,000 rubrics. The repertory is a Kent-based repertory with emphasis on generalization. The philosophy was presented at National Conference HMAI in the Science City, Calcutta. Now I request Dr. M. Satish Krishna sir to start with today's presentation. Thank you.
I request Dr. Satish Krishna to take over to the presentation part. Dr. Satish Krishna will today highlight the importance of generalization with its pros and cons. Generalization process of prescription has been practiced by very few doctors, which was a method started by Boeing Hassan. So he will be highlighting the different pros and cons of generalization process of prescription. Please do see his work, and we all wish him good luck. Thank you.
Good evening, one and all. Thank you for giving me the stage to share my research findings with you all. My respects to the dignitary and the jury who has been presented on this dais. A warm welcome to all the delegates and my friends. Before I begin, I would like to introduce myself that I am Dr. Satish Krishna. I have done my BHMS from JSPS Homeopathic Medical College, MD in Repertory, and I'm pursuing my PhD from Homeopathic University in the subject of repertory. This afternoon, I would like to discuss the importance of generalization, its applicability and its limitations in the repertorization by citing an exemplary case. And this research study is one step forward to the existing methodology in the new and creative way so as to generate the new concepts and its effectiveness when we have the paucity of rubrics. This study of efficacy of generalization of the rubrics is carried out in two research centers, one from Homeopathic University, Jaipur, and AM Sheikh Homeopathic Medical College, Karnataka. And corresponding CTRA trial registration has been taken and ethical clearances has been done. This is a case study to understand the importance of the concept of generalization. I would like to present a case of a lean, moderately built male of 68 years of age, goldsmith by profession, reported on 25th March 2022. His physical makeup is 5.6 feet height, 55 kgs of weight, dry skin, dry complexion, and an anemic personality. The lesion started gradually around 5 months back as a painless ulcer on the glands, later developed as a fully grown tumor, reported later to an allopathic doctor. The patient denied any associated pain, bleeding, odor, or any discharges to the previous issues. There was an history of urinary retention, but it was not specific. Undergone circumcision in the year of 2018. The patient has denied any outside sexual history and reported being a monogamous relationship with his wife for 45 years. He denied any erectile dysfunction. The patient was otherwise healthy and family history was uncontributory. And prescription, the previous prescriptions I would like to share on this video. Can we get on to the slide number 8, please? This is the previous prescription. It has been, I have intentionally cropped the name, and it has been taken by an allopathic doctor. And it has been perfectly written that it's a well-differentiated squamous cell carcinoma on the glans penis. And later he has approached NIMS hospital for further evaluation. And he has gone through many tests where they have planned for circumcision, which has been done previously. They have planned for removing the tumor, radio and chemotherapy. And astonishingly, we found that there was a massive cardiac block and is a high risk case for surgery. So they denied to go to the surgery. And they approached me in the year of 2022. Complaints presented. There was a pain in the penis. Can I have the second slide, please? Next slide. Slide number 10. Slide number 10, please. Slide number 10. Hey, you can just go on to the slides. No? Complaints presented. Pain in the penis since a week. Pain in the left inguinal region since a week with a swelling. Inflamed left inguinal lymph node since 1 month. Pain in the abdomen since 1 month. Weakness with numbness more in the lower limb since a month. Pain in the soles and palms since 3 months. Profound weakness since 3 months. Next slide, please. History of presenting complaints. There was a cramping pain in the abdomen, especially in the umbilical region. Pain in the pubic and left inguinal region. And there is a pain in the penis since a week. The pain of the penis is very perfect in the character. There is a sharp pain shooting in the region of penis, and it is going deep into the pubic region. And there was a peculiar modality that whenever he takes a deep inhalation or whenever he has the yawning, he'll be getting the pain increased. There is a sharp increase in the pain whenever he takes the deep inhalation or yawning. And palms accompanied with a cold perspiration. Palms and soles feel moist, cold and clammy. Profound generalized weakness more during evening hours. Next slide, please. Cramping pain in the abdomen, no specific modalities, but occasionally aggravated during sleep or whenever he stretches out to reach something. On raising from the sitting position, pain in the pubic and left inguinal fossa is more diffuse in the nature, almost constantly present. He has this complaint since 10 days. Onset was sudden. Nature of the pain is stitching and burning. Pain increases whenever he takes the deep breath and yawning. Pain radiates from the glans penis. On systematic inquiry, there was a reduction in the appetite for since 3 months, occasional fever-like symptoms, but it was not specific. He was observing a weight loss since few months. Bowels, ability to pass stools and flatus was normal. Urine, there was a retention, often experiencing the urinary incontinence. Occasional urinary retention with the pain in the pubic region. Presently, he has incontinence. History of smoking and drinking now stopped completely. Progression of the disease. Progression of the disease. He has taken the allopathic treatment for the obstructive urinary flow in the year 2015, 17, 18, and 19, and underwent circumcision in the year of 2018. In the end of year 2021, he developed a small painless ulcer-like lesion in the glands, and he is doing dressing by himself with the use of saline solution and Dettol. A wart-like growth started developing on the penis. This made him to consult the doctor. Allopathic doctor who suspected to be an allopathic doctor who suspected it to be a cancer and referred to a higher centers. Biopsy confirmed that he has an advanced stage of squamous cell carcinoma. They are planned for surgery, followed with radiotherapy and chemotherapy. Surgical profile showed a massive block in the heart vessel with a weakness of the heart muscle, termed to be a high-risk case, referred to the NIMS hospital. The patient and his son did not sign the high-risk consent for surgery and radio or chemotherapy. Next slide, please. I'm just showing a extract of this. This was been taken from the NIMS prescription. He explained in detail about the risks involved in the surgery, including the chances of MI, bleeding, and infections to the patients with his son. And next slide, please. And they have explained it in detail. And finally, I have been pointing out there was an unwilling for surgery and unwilling for radio and chemotherapy. And this person later has attended our clinic. While taking his case, we have gone through the mental generals. The person was very irritable, fears that something terrible is going to happen for him with anxiety, feels his disease is incurable. This is common because he knows that it is a case of cancer. So it is a common symptom that he feels that the disease is incurable. Dislike to use his brain. When we have gone through the history of his mental symptoms, he usually sits in a very comfortable manner. Dislike to use his brain, especially when discussing for any new designs, because he is a goldsmith. Usually they will be planning with a new designs and new works. So he used to not put his brain into these aspects. Instead, he sits and goes the routine activity. He worked under his father and now he is working under his brother-in-law and his son. Too lethargic since young days, but he has a good number of friends. On and off, he has a frightful dreams, which in turn increases his fear and anxiety. Next slide, please. Physical generals. Chilly patient, thirstless, lean and weak, generalized weakness, especially in the evening hours. While going through the past history, we almost 3 or 4 times we asked him that is there any history of outside sex, that he has denied. He has denied the outside sex. And he has taken COVID vaccinations in the year 2020 and 21. History of circumcision in the year 2018 in a local nursing home. Urinary obstruction in the year 2015, 17, 18, and 19. Recurrent typhoid fever, not specific, between the years of 2010 and 15. Family history. He has 3 daughters and 1 son. All are healthy. An elder grandson of his elder daughter is an autistic child, and another grandsons and daughters are healthy. Wife is diabetic and hypothyroid. Father expired 10 years back with unknown fever. He has 2 brothers and 1 sister. All are healthy. personal history. No specific desires and aversions. All the we have noted one peculiar symptom, but it's a general symptom. All the family members has both the tea and coffee, but he drinks only tea, no coffee. Occasionally alcoholic, smoking 5 to 6 cigarettes per day. Now for the last 1 year, he has stopped taking both smoking and alcohol. Next slide, please. On physical examination, now we can see there was a 1.5 into 1.5 cauliflower-like polypedal growth on the glans penis. Okay. And there is a inguinal swelling, which you can see between the fingers also. There was an inguinal lymphadenopathy well appreciated on palpation and tenderness. This was a 1.5 centimeter cauliflower-like growth. We have taken the rubrics. Almost 18 rubrics were being taken. From the mind chapter, we have taken work, mental aversion to, and male pain in the penis, swelling in the inguinal region, and there is a burning sensation in the palms, soles, and cancer of the male penis, and a rubric from umbilical region that there is a cramping and gripping pain in the umbilical region, and also the pain in the inguinal region. And in the mind chapter, again, we have taken fear of death, dreams of frightful dreams. And in the extremities chapter, we have taken the rubric of numbness in the lower limbs, especially in the thighs and legs. Weakness is a generalized weakness, and weakness, especially in the evening hours. There are 18 rubrics which has been taken. And next slide, please. And on repertoration sheet, we got lycopodium, calcarea, phosphorus, sulfur, conium, arsenic, sepia, pulsatilla, thuja, graphitis, causticum, and laxis. Among which I have selected thuja, since and given thuja 31 dose a day daily, placebo 2 gram pills 3 times a day daily. We have selected this medicine basing on the tumor, antipsychotic and antisyphilitic in the nature, recent history of COVID vaccination, because in the history he has dealt that he also explained that the complaints of weakness started after vaccination, and he was the chilly patient. So it has given me to select thuja. The follow-ups from 25th, because we have given on March 2022 on the date 25th till 5th of June, he has visited at OP for 6 times. With no change in the pain and weakness. There was slight improvement in the numbness of the limbs. The burning sensation in the palms and soles were also been improved. He has under the placebo and thuja 1 dose daily in the night. Because it's a cancerous case, I started using thuja daily, 1 dose daily. And almost I have prescribed around 40 to 50 doses. And there was no improvement in the physical well-being also. Then I have reanalyzed the case because the pain is increasing day by day, and he started crying in front of me. So on 5th of June, that was on Sunday, we have retaken the case. And again, we got the same set of symptoms. And only thing that there was slight improvements in the rubrics which were taken in the extremities chapter, and reconsider those rubrics. But in the previous case, in the previous arena, we have left down a rubric, left down a symptom as one modality which is prominent: pain in the penis extending inwards, aggravated by deep breathing or yawning. And while we are going through the repertory, we could not able to get any kind of rubric to this kind of symptom. So in the earlier case, we have deleted that symptom. So we have taken 18 numbers. Again, I have sorted, let us go with the symptom. And I have generalized this rubric because on searching, I got a rubric from the abdominal chapter that the pain in the inguinal region, deep-seated, aggravated by yawning or deep breathing. We could able to get one symptom which is very nearer to the symptom which has been elicited by the patient. So I thought of going to that. Once I have selected that symptom, I have got one medicine called oxalic acid. Then I said oxalic acid, which I have not prescribed to any other case previously. So once I have taken the previous reportorial sheet, I have seen the oxalic acid also has covered many number of rubrics. And which has been, because of less marking, it has been completely gone underneath. And I have seen 17 rubrics has been covered previously. Now I have taken another rubric of abdomen and prescribed oxalic acid 30 potency once for a week daily. And in the span of 1 week, the patient complained of increase in the pain and increase in the size of the tumor. I got shocked because instead of reducing the complaint, we started increasing the complaint now. So I stopped immediately. I stopped prescribing oxalic acid and told them to just continue with the placebo. 3 days after placebo, we could able to see that the pain has got on 18th of June. The pain was very intense, advised to continue placebo for every 3 hours. On 19th June, we have seen the tumor has been detached completely and the burning has been reduced. And the comfortability and the weakness came into picture. Then she has developed into a good comfort and weakness also has been improving. This is the latest picture which I have taken in the month of January. And I have been giving this medicine for every 3 months because he comes from Gajwel, which is near Siddipet. Once for every 3 months, in case if there is any problem, he will be approaching his son will be approaching to my clinic. And this was the picture. And complete, the growth has been completely gone. And we can even see a slight patch on the penis, but there was no pain. And since then, I started giving oxalic acid monthly once. It's not daily. I started giving monthly once because I have a suspicion that if this tumor grows again, this oxalic acid has to be removed. But I think since these many months, oxalic acid is removing that tumor in the powder form, I think, because there was no increase in the tumor. Is this astonishing? Have you ever thought of oxalic acid in the cancerous case? And the topic of generalization really helped me to select this medicine, because I was planning to go with Tuja, nitric acid, and even I thought of going for a Merxol also. But luckily I got a symptom called, luckily I got the rubric from generalization. Now I would like to explain what exactly is the generalization and what exactly Bonninghausen has told and why it has been sidetracked nowadays. The Bonninghausen principle of generalization is an attempt to give the importance of those modalities which were lacking in the repertories. Actually, this is the importance which everyone has sidetracked it. There are many symptoms which we could not find in the rubrical form. Then Bonninghausen said that in case if you don't find the rubrics in the modalities, you can have the generalization method when the same rubric, when the same modality is present in 2 or 3 places. You can generalize it and apply it. In his lesser writings, he quoted that I was with Hahnemann in the last days of April 1832, and at the preface allude to this dated only a few days later. It was more surprising as it was impossible that he should have the time in these few days to verify my enormous discovery. He was feeling annoyed because he has given the same discovery. He has showed the same discovery to Hahnemann also, but Hahnemann could not able to do it because he was in his last days of his life. This principle was greatly appreciated by many stalwarts, but later severely criticized by Kent and Herring. Let me begin with the criticism. If the principle of generalization is applied to every particular symptom, converting it in a general, the lot of damage will be done to the homeopathy. But this was given by Kent actually. And he has quoted few of the examples there. The pain in the knee joint worse by initial motion and better by continuous motion calls for Rustox. That was a normal materia medica symptom. If a patient says that he gets a pain in the rectum during the early part of passing stool and it does not pain later on, will that also be the symptom of Rustox by generalization of the modality? Because if he says that while passing stool, if he has an initial aggravation, when the initial motion is very hard and later on the motion passes freely, can you give Rustox basing on the generalization? If the patient says he tends to get nervous on starting to write the examination, as do I now, because before I begin, I was a bit nervous and later on I could able to do in a normal form. really do the Rustox work for me now? Yeah. If Rustox works, what about the silicea? The stiffness of the joints, Rustox, cannot be transcribed to the stiffness of the mind. The yielding palsal also can have a stiff neck. So these are some of the examples which Kent and Herring has given. The combination of sensation and location makes a symptoms characteristic. For example, the stitching pain in the fingers call for cicuta, while the same pain in the chest calls for bryonia. Or if the dorsal region may require petroleum and so on. Blind, here let us emphasize the word called blind grand generalization will certainly take away the characteristic particulars from the materia medica. Because this was what the Kent has narrated, and he has even given the way for us that never go for blind grand generalization. This doubt of effectiveness, but once if we go with all these criticisms, I have a doubt. Once if there is any this grand generalization is fully packed with criticism, why Boninghasen has selected grand generalization? So this doubt has really packing me since a longer years. Then I started doing my research on the same aspect. When if I do grand generalization, if I do generalization of the rubrics, can we really get the results? And I have really found out many cases which has been solved easily. When we have taken the normal case study, we are really getting popped up with almost 15 to 16 medicines. And we need to select 15 to 16 medicine basing on the materia characters. But there are many pictures where even the characters of the medicines are very unique. And it really confuses us which medicine has to be selected. And on trial and error basis, we will be selecting one medicine. And if it is not been working, we are retaking the case and we are going for the next symptom again. So when we are doing grand generalization, when this is a modality which has been generalized, and the generalized rubric really contains a very few number of medicines. And if I started using that, if this generalized rubric, if the medicine which has been popped up from the generalized rubric is been covering any other symptoms also, if it is covering and this is working in a very beautiful manner. So I thought that exactly the Boninghasen wanted to say this, because we should not do the generalization in a blind way. Select the generalization basing on very near similarity of the symptom. Because in the previous case, I have taken, again, if I say the previous case, this is a chapter which has been selected from the male system. So the rubric, usually cancer of penis is present in the male chapter. And I have generalized this rubric from the abdominal chapter. Both are completely different chapters. But why did I generalize is, the pain from the penis is going deep into the abdomen. So we are eliciting the pain even in the abdomen also. So let us go into the abdomen and let us search for the any kind of modality in that abdomen chapter. And I really got that rubric called the pain which has been aggravated by deep breathing or yawning. So we got we had around 78 medicines in the repertorial sheet. Among that, I have selected only oxalic acid basing on this. And you have seen the result for that. It has worked. Previously, I have listened to a seminar in Chandigarh. A girl she has said that a sweet pill works like a sweet pill of homeopathy works like a surgeon's knife. And we have used the same sweet pill to remove the tumor. And the tumor which is to be removed, they need to go for the thorough health checkups and chemotherapy, radiotherapy, everything. And they need to spoil their lives, their wellhoodness, everything will be spoiled. But today, with no expenditure, with no pain, the tumor has been detached by itself with the medicine of, it's not single dose of oxalic acid, it's a repeated doses of oxalic acid. And later on, the same oxalic acid, but I was very much feared that I don't want to change this medicine again, because what happens next, I really don't know. So I started using this oxalic acid once a month, because in case if there is any growth on the tumor, this oxalic acid cuts away. Now this is working like a knife, a surgeon's knife, that we can say is a homeopathy surgery. And this doubt really has placed me this one, where this principle went wrong. Is this principle really wrong? This made us to go depth into the principles of generalization. According to him, generalization is a concept where a modality has been present in two or more places can be generalized as a homeopathy believes in body, not in parts. Or according to him, both are not different. He and his disciplines has started practicing on it and done better. Later, he has adopted this principle in a literary work and is in lectures. We made an attempt to revive the Boninghasen's, we means our professors and our colleagues has made an attempt to revive this Boninghasen central philosophy and its practical application by generalizing this rubric. This principle has given a very good results when we have generalized the rubrics from the same chapter or from the chapters of the same system or from the chapters having the close resemblances. These are the things which I really wanted to share with everyone. This principle has given a very good results when we generalize the rubric. Rather than generalizing the rubric randomly, we need to generalize this rubric from the same chapter because usually it contains the same number of modalities or from the same chapter or the chapters of the same system. I have done a generalization in the chapters of respiration and cough, in the chapters of stomach and abdomen, because in the stomach we have different modalities and in the abdomen chapter we have different modalities which has been covered. So both belongs to the same system. And in the chapter of urinary system and bladder and kidneys. So this is working really great for us because all these systems are working in the same plane now. From the rubrics of the same chapter or the chapters of the same system or from the chapters having the close resemblances. In the previous case, which I have been narrated, is the chapter from the close resemblance because there is no relation between a male chapter and a abdomen chapter. But the symptom has a close relationship. This has minimized the errors generated from the generalization. This is what, because Dr. Kent has said that he has given the Rustock's initial movement aggravation in the joints, and he has quoted an example in the brain. So there is no relation between a brain and a joint. So we cannot generalize this rubric because brain has got a different type of approach and joints has a different type of, because the connective tissue and a nervous tissue. So both of these doesn't have any resemblance. So really doesn't work. And we really land in spoiling the materia medica. Significance. Next slide, please. Generalizing the rubric was systematically validated because I'm pursuing my PhD in the same principle now. I have validated the same research with the research protocols. The fruits has yielded us a good amount of data that will help us to fit those gaps in the repertories created due to paucity of rubrics. Because we need to fill those gaps. Actually, when we nowadays we can say that homeopathy is increasing drastically. For the last decade, the homeopathy practitioners are having the good number of cases, and we are having the challenging cases also. As do so, because I have another case of cancer, which has been treated on generalization basis, and I have given kali iodatum in that case, and it's a case of rectal carcinoma, is a stage 4 adenocarcinoma of the rectum. We have got a beautiful case, and we have taken that case in the year 2019. And Basavatarakama people, they have said that he may be living maximum for 6 to 8 months. And this person has not gone for radiotherapy because of the fear that they will be doing something. And he came backdoor from the Basavatarakama. And he approached me, and we have taken the case, and almost 5 to 6 months, the case was going in a normal way. Later, we got a rubric. I remember that rubric is, he is to have a pain in the rectal area. That's a common symptom, pain in the rectal area, especially in the evening. Every day you'll be having the pain in the rectal area, especially in the evening hours. And whenever he lies down, in the bed, the pain relaxes. And the same pain, if it is present somewhere in the morning or in the nighttime, if he lies, he should not get the pain. But during these hours, either in the day hour or in the night period, if the pain comes on, even if he lies also, pain doesn't relieve. This is one peculiar symptom I got the pain in the rectal area ameliorated, especially in the evening hours, ameliorated by lying down. So I have gone through rectum chapter. I could not able to get the rubric. The same rubric, I think I got in somewhere other chapter, where kali iodatum, I don't remember that exactly that rubric, where kali iodatum was the only medicine there. Once going back into the reportorial sheet of the previous taken case, even kali iodatum has covered the rubric, symptom of cancer of rectum. So I started giving kali iodatum repeatedly in 30 potency, and drastically the pain has reduced, because he has the agonizing pain whenever he passes stool, or he has agonizing pain, and the pain has drastically reduced in that case within the span of 1 week. And he used to have a lot of hemorrhages from the motion. He used to use the pads, the sanitary napkins, to cover those bleeding, and he was totally anemic. And within 15 days, I can say within the span of 2 weeks, he resides in West Godavari district. And within 2 weeks, he called me that even bleeding has reduced. So till today, I have not changed the kali iodatum. I have been giving kali iodatum 1 dose monthly once, because I am not repeating, because the case has been improving properly. I am not repeating too oftenly, once in a month. And this is somewhere I have started the case in 2019. Today is 2023. The case, he is in a normal way. He is normal way, is having his normal life, and he is a farmer there. So let us see, but latest PET scan also, we have taken the latest PET scan in the month of December last year. The size of the lesion was, I can remember that it was 5.1 centimeter and 2.1 centimeter in the rectal and anal region. Only 0.1 centimeter has reduced. And there was no spread of this cancer, because adenocarcinoma has a character that it can easily spread in. And we have a suspicion that it may even spread to the ureter tube, because the ureters are very close to that area. We thought of having that even we may get the, but kali iodatum is really working a lot to this case. And there was no chemo, and there's no radio, no surgeries, no bags, nothing at all. A small dose of kali iodatum, 30 potency, this one. So significance, what does this do? Generalizing the rubrics is when it has been systematically validated as per the research protocol, the fruits has yielded us the good amount of data and will help to those gaps in the repertories created due to paucity of rubrics. And I really caution you all people, never generalize a rubric when you have the good number of rubrics. Generalize only when you don't find a PQ or a symptom in the repertory. When you have that symptom which is not being a PQ or a symptom, don't generalize it. It's better that you leave that symptom if you don't have the rubric. But if you really find out that it is a well-differentiated symptom and it's a PQ or a symptom, never leave that symptom. Because in this case, which I have narrated, in this case, I have not taken the symptom, which even though it is a PQ or a symptom, I have not taken because of the paucity of rubrics. When I have taken oxalic acid into consideration, the tumor has been detached, the polypoidal tumor. So homeopathy works great. So we need to use this machinery whenever we have paucity of rubrics. Conclusion. This study gives a positive note on the concept of generalizing the rubrics. Further, an extensive study need to be carried on the larger sample, because I have taken a sample size of 170 people. Now I am doing my research activity on the generalization topic on typhoid fevers. And I was fortunate enough, I should not say as a doctor actually, I was fortunate enough that Corona has really popped up my cases. Because nowadays, everyone are coming to our clinics because of the fever. And we are taking these samples. Everyone are going for viral tests, even without, I used to think that I need to pay for all these viral tests, because nowadays these people, they are doing by their own, because the case itself is a fever case. I am writing a viral case. If it is the viral is 1:160, I am taking into my consideration, and I am saying that I will do this one. And they are giving us the consent also, because all people are in anxious position now. Because we are saying that today we have a virus which we have not been seen earlier. So we are doing research on it. And everyone are giving me the chance that they are giving the consent, and we have got a very large sample. Instead of getting 170, I have got around 400 samples with me. And I have completed even my analysis chapter on this one. And finally, I could able to say that this need to be taken on a larger samples with various repertories. I have taken a complete repertory, which is a complete is a Kant-based repertory. And I want to use this principle because Bonninghausen's principle of generalization cannot be worked on Kant repertory, because Kant's principle is completely different. Now I started using this principle, Bonninghausen's principle, on Kant repertory, Kant-based repertories, and it is working good. So I can say that Bonninghausen was one of the greatest homeopaths who has given the beautiful research activities, and there was no conflicts of interest. Lastly, my respect to the host, the organizer, and other participants for their presence and contribution to this event. Thank you, Hamad, for giving me this opportunity.
Thank you, Dr. Satish, for giving a beautiful case of carcinoma of penis, and that too based on the generalization principles of Bonninghausen. Now the session will be open for discussion, and I request the people in the audience, if you have any questions, you can ask. And even for the participants of who are online, you can also ask your questions. Just unmute your mic, and then you can ask the questions. I request Dr. C.V.Swamy to kindly give some insights on the case which has been presented just now. In the meantime, you can raise your hands. The participants who are online, you can just raise your hands so that we can register it here. Dr. C.V.Swamy, sir.
Good evening, friends. I heartily congratulate Dr. Satish for his wonderful case and very nice presentation. It's a very good, even though it is not a complete cure, it is definitely on the way to be cured. It is a wonderful case. This case has two aspects rather. One is the efficacy of our medicines, even in cases like malignancy, where there is no scope in any other system, and patient has many health-wise limitations like heart blocks, where they cannot go for surgery or radiation or chemotherapies. This case proves that we have a great scope in treating such cases. And another aspect of Dr. Satish's presentation is regarding generalization of the rubrics, grand generalization of rubrics. In this case, in this aspect, Bonninghausen's philosophy is exactly opposite to that of the Kant's philosophy or theory, where Kant says what is applicable to the whole man, like it is like general symptom of the mind or body, is applicable to the every particular or every part of the body. Whereas Bonninghausen says any particular modality or a rubric can be generalized to the entire person. We are in crossroads in some cases, which is to be taken, which is not to be taken. He has taken a very good aspect by doing the research in this way, where to generalize, which cases to be selected, which cases need not be generalized, where the particular need not be generalized. This is selective generalization of the particulars. It's a wonderful aspect. It gives a very good scope for us where we don't find proper rubrics in the repertory. Where there is a paucity of rubrics, how this technique can be utilized in our cases. It is really good. It gives very good insight for us in repertorizing cases. Thank you very much. Thank you, Satish.
Thank you, Dr. Swamy. Any questions from the audience in the hall? Or even online, if there are any questions, you can ask now. Dr. Venu, are there any questions? No. So we'll move ahead.
Sir,
Now I request the President, Dr. Gopala Krishna sir, Dr. Durgaprasad sir, Secretary, and Dr. Hemaprabha Madam to come over to the dais. And also request Dr. Venugopal-Gouri to come over to the dais.
Sir.
I request the President of HMAT, Dr. Gopala Krishna sir, to present a memento to the speaker of today's evening. దీని తర్వాత Dr. C.S.Murthy. I believe there is a question from Dr. C.H. Subbarao. Dr. Subbarao, you please unmute your mic and ask the question, please. Dr. Subbarao, you please unmute your mic and ask the question.
Sir, could you please elaborate the grand generalization of
Thank you, Subbarao
modality?
garu.
Sir,
Your question is, can you please elaborate the symptom of grand generalization?
yes, sir.
Boningasan's grand generalization.
Yes, sir.
Boningasan's grand generalization is a topic which has been taken by Boningasan when a same modality, for example, if he has a pain which is being ameliorated by sleeping, if he has a pain in the shoulder which is ameliorated by sleeping, and if he has a pain in the chest which is ameliorated by sleeping, and if he has a pain in the knee joints which has been ameliorated by sleeping, and if we require a symptom like pain in the eyes which has been ameliorated by sleeping, if you don't have that rubric, because I'm just giving an example, I have not gone through the repertory now. If you don't have the rubric of pain in the eyes which has been ameliorated by sleeping, then you can generalize the same symptom which has been present in the three other different forms. And if the same medicine has been present in the three different spots, you can generalize the same medicine for the eyes also, because he always says that we should not divide the body into parts. All the modalities equivalent to the part is equivalent to the body. So the word called grand generalization can be taken only, I emphasize exactly that the word of grand generalization has to be taken only when you don't find a proper rubric in that particular chapter. There's a proper modality, a rubric for that same modality in the chapter, and the same modality is present elsewhere having the same medicines in the same chapters. You can generalize it and you can use the same medicine for this modality also. And it really works.
Thank you, sir. Thank you, sir.
Dr. Subbarao, I think you have got the answer.
Yes, sir. Yes, sir.
I request Dr. Durgaprasad sir to come out to stage to.
So, good evening, all the lady doctors. This March month, the commemoration of International Women's Day. On behalf of HMAT, we congratulate and we thank all our lady doctors for their support and for their this one. Especially this year theme is digitalization of all technical and this service to for the innovation and technology of female side. So let us hope this year the ladies come forward more in number and do more innovations and technology side work for the cause of society benefit. I thank all the lady doctors and I request the doctor to hand over the bouquet to all our lady doctors. One more thing, coming month in the month of April, during the 268th birthday anniversary of our master Dr. Samuel Hahnemann, there will be a good scientific session on that day. And one more important thing, on the eve of the Hahnemann birthday celebration, commemoration, we are installing Hahnemann bust-size statue in our auditorium. And I request all the doctors who are present here and even who are present online also to witness the program physically and make it a grand success. Okay, thank you.
Now I request Dr. Venugopal-Gouri to give the vote of thanks.
Good evening, everyone. We thank the sponsors of Dr. I.S.Murthy Memorial Oration, Dr. Hema Prabha ma'am, for instituting this lecture in the honor of her great father, who was also a physician with us and served our system of medicine, homeopathy, and in a very charitable way also in the past. And we thank the president to see that the institution of this lecture continues. We thank the good donors of our association, Dr. Srinivas Gupta and Dr. Madhu Varnasi, Dr. Subhashni Reddy ma'am, for coming forward to donate for the Corpus Fund. And we thank Dr. Satish Krishna for that beautiful lecture this evening on Boningerson's grand generalization. It's a matter of fact that apart from Hahnemann, during his times, if there was one homeopath who could stand tall with our founder himself, it was Dr. Boningerson himself. In fact, Dr. Hahnemann was a man who was open to ideas, who was open to new things, and he was never dismissive of people who would come with a thought which was not in tune to his line of thinking. He was a man who would not be in a rubric of contradiction ailments from. He was a man who was friendly to anyone who was also, despite his thinking, who would come forward. And Boningerson was such a gentleman who put more stress on, as we know, causation, location, sensation, modality than anyone else. And what Dr. Satish Krishna spoke today was about the same thing. It was more a generalization in the sense, like the English language has two words, general and common, which may all sound so similar. But for a homeopath, a general is a symptom which covers the whole body. A common is such a small symptom, or we are so dismissive of a symptom, which is called a common symptom. But what Boningerson said was, a common symptom is something which we need to give more credence to. In fact, as a matter of fact, if we have most of the good practitioners in the past and and until today, it is the people who also give good importance to the common symptoms. And the reason why the common symptoms can sometimes be more important is it can give immediate response to any patient who is suffering from an ailment which is very specific to the area. So as long as the sphere of action of a remedy, however small as oxalic acid as it may be, if it pertains to the location, if it pertains to the suffering of the patient, it will work, no doubt. That is the reason why, even if it is a symptom which does not have hundreds of symptoms, like a deep acting remedy like a sulfur or a carbonium sulf, which will crop up in probably every other rubric of repertory, remedies like oxalic acid will have their role to play. All these days, we were only thinking about oxalic acid as a remedy which will have a typical symptom like something, pain referred to a particular area of the body, pain in spots. But what Dr. Satish Krishna's exposition of this particular case of carcinoma of the penis shows that if there is a suffering which is associated with a typical pain in the abdomen, oxalic acid comes into play as much as any other remedy. Thank you, Dr. Satish Krishna, for that beautiful exposition, and we look forward to more such things in the days to come. And we thank the delegates this evening for having come here and attended this lecture. Thank Dr. C.V.Swamy for giving a concluding remarks about the topic spoken by our honorable speaker today. And we also thank the participants who have come in on Zoom, and we look forward to seeing you more in the days to come. And as our Secretary, Dr. DurgaPrasadRao-Ji has said, next last Sunday of April, we will be celebrating the Hanuman celebrations. At the same time, we will be unveiling the bust of our Father Hanuman here. And we look forward to all joining in here that evening. Thank you, one and all.